Hey guys, as discussed, or as we put up in a story yesterday, Emil is joining me today. So Emil's a psychotherapist who's going to come on. We just want to quickly chat about mental health, obviously being a big issue in the current times. I don't think there's any doubt about that it's not exactly the easiest time for most people, to say the least. There's no two ways to put it. When you're stuck without the liberties you would usually once have, it's not a good time. Emil is here, I think. So, like I was saying, Emil is a psychotherapist who obviously practices in mental health, and I apologise. There we go. He's here. Hey, mate, how you doing?
I'm doing well, man. How are you?
Pretty good, pretty good. It's an interesting day because Melbourne, you guys, obviously your construction workers are being hit now by the mandatory vaccination directive, we'll call it, down there. Healthcare is about to get hit as well. I believe that was announced today. So we're going to have some serious problems down there. WA's already been hit. New South Wales are already fighting that fight. There's some law firms in the Supreme Court and potentially one going to the High Court soon. So I'm going to say it's a pretty fucked up state of affairs all around Australia right now, in my opinion.
Well, that'll be an understatement, man. It's a tough time to be alive at the moment in Australia. I mean, we've got the eyes of the world on us right now, and there's a lot of stuff going down. So here I am trying to make a bit of sense about it from a mental health point of view. But I really appreciate what you're doing from a legal standpoint, and I've learned a lot from you, man, since getting on board. So yeah, here we are, man.
Cheers. Well, look, I think a lot of us are trying to make sense of it, to be honest. Let's be real. For everyone here, I think, and I've said this a few times, we've been way too apathetic as Australians lately. Well, not lately, in the past few years. In the last 20, look, I'm 34, so that gives my age. But in the 34 years that I've been around, not much has actually happened. You might have some issues here and there, racism, First Nations people obviously have felt it, but generally it hasn't been at this level. Now it's hitting everyday Australians. Doesn't matter what religion you are, doesn't matter what skin colour you are, it doesn't matter what your profession is at this point in time, unless you're a politician perhaps. You get hit by this left, right and centre. So when general Australians are getting hit, it changes the nature of the play, and I think that's where you're coming in from. You're seeing, I'm assuming, massive declines in mental health because when you take someone's liberty away, like, for example, if we have a so-called criminal goes to jail, that's one thing, right? You take their liberty away. They're not going to feel good in there generally, unless they rise to the top of the crop and become some kind of hero in jail and get some kind of luxury. But here, you're no longer seeing your family. Parents can't see their kids because kids are being used as a pawn in certain cases when you have childcare. You can't socialise with your friends. I mean, forget travelling. Travelling, to me, this is my subjective opinion. If you like travelling, that's fine. That's a lesser issue. But if I can't see my parents and my family, that's huge. If I can't see my friends, that's huge. And if you're living by yourself or you're a single parent, life is tough. Really, really tough. What's been your experience?
Well, I think you've hit the nail on the head now. The people who are the most disadvantaged we are seeing are the people who are the most vulnerable. And this is really, really difficult to swallow because when it comes to vulnerabilities, already the deck is stacked against you. And here comes a pandemic. At the beginning, no one knows where it's coming from. There's an invisible enemy out there that could, take the feet from underneath you at any point in time. You can't see it coming, which is a bit different when you know something's coming at you. And then you've got these mandates, you've got these restrictions, which most Australians are pretty happy to go with at the beginning. And then, as time goes by, more and more people are starting to question these particular types of mandates, especially from a mental health point of view. And when we start to see the disadvantaged being affected the most, this is a problem because it's always been like that. Anytime something tough happens, it is the people who have negative mental health at the beginning that stand to lose the most. You survey literature across the globe, already people are doing it tough. And then you've got, the World Health Organization put forward a report and they said in 93% of the countries that are signed up with the World Health Organization, you're starting to see months upon months upon months of waiting of waiting times for mental health services. You see more and more people's mental health decline. You're starting to see suicidality, which is different to suicide. Now, that's really important distinction to make. You have self-injury, you have suicidal ideation, and then you have suicide. And when it comes to suicidal ideation, there's a lot of stuff. I mean, you're thinking about suicide, you're contemplating it. And self-injury is a little bit different, where people do it for all sorts of different reasons. But already I
want to say, just quickly, stand on it for 1 second. I've heard people say this. I think it's bullshit. So I'm not saying this personally, but suicidal ideation means you're soft. Like, I'm sure you've heard that too, because everyone does it. I think it's bullshit, guys. I'm just straight up. Don't hate me for this, but that's something I want to bring you as a mental health professional. What do you say about that too?
Okay, so I see suicidality or suicidal ideation on a continuum. And I think we all fit along that continuum. And that could be like, never thought of suicide in my life. I think that's total BS. And then on the other side of the continuum is a person who has suicided, which, mind you, is the new term for committed suicide. I mean, it's suicided. And then most of us fit along that continuum. It's like, and often it goes around, I wish things were different. I wish I wasn't here. I'd be okay if I weren't able to wake up tomorrow morning. These are the suicidal ideations, rather than I'm going to hurt myself, or I plan to kill myself, and these are loaded terms, but I think more and more people are starting to notice that things are not okay. Things are a little bit difficult, and this is the clincher. There is no hope. And when hopelessness, I mean, psychologists, psychotherapists, counselors, mental health professionals across the board, they need to tick off, when they're looking at suicide screens, it's all about, at the beginning, you're asking hopelessness and helplessness. These are two main things that are measured in any type of suicide battery, whatever you want to call it. And it's a matter of knowing, is there hope at the end of it? And are you feeling helpless? The evidence will be stacked against it, because these days in Australia, more and more people are feeling hopeless. More and more people are feeling helpless, especially our children. I was reviewing the data, and more and more children who are denied school are starting to feel helpless, as if they can't do anything to change. And this is against their own abilities as well. It's heartbreaking to see, man.
Well, a child can't really do anything because their parents are saying, you better not go to school because this is what they're saying. These kids are stuck at home unless they run out the front door and say, screw you, mum and dad, I'm going. Like some of them good at the parks, by the way. And I think that's very effective in a certain sense. But when we're using kids like this, and arguably the politicians are to a certain extent, they don't have much they can do. And this is the biggest problem. So, of course, they're going to feel that way. And one thing I want to bring in is, I've said a number of times, everything is relative. How you feel, how I feel is relative to our situation, to our backgrounds, what we've gone through. So if someone has had a absolutely adversity-free run for the last 5 years, all of a sudden their businesses have collapsed or they've lost their jobs, they're going to feel bad, full stop. It just might be at a different level. And this is where there's a lot of people that turn around and go, well, no, it's not a real issue. This is bigger, that's bigger. What's happening in Afghanistan's bigger. Well, there's actually about 20 wars going on in the world, but everyone seems to forget about that. What's happening in Syria, what's happening in parts of Africa, they forget. But what happens here is very important. What's happening to these kids, as you said, is very important. Everyone's mental health is relative to that person, I believe, not just at that time, but as a product of them growing up and their experiences too, which is, I think, a big thing that people tend to miss. And it's very easy to say, it's not that bad. Just suck it up. It's worse in another place. We'll deal with it. Whereas some people say to kids, oh, yeah, you're not going to school. It's fine. You're staying at home. You must be loving it. Well, they can't go to the park in Melbourne for a certain extent, at least for a few weeks. So that wasn't allowed either. You walk outside and you get belittled for being there. I can understand why they feel helpless.
Yeah, and I totally pick up on your point, and which I actually want to expand on. I've reviewed a bit of data across the world, and the data that I looked at was the French. There was one particular study which looked at the French responses to COVID-19 lockdowns. Now, what they notice is that right, France, from the beginning, they have a lot of immigrants that come in from war-torn countries as well. You know, people in the population have a lot of experience with war, with terrorist attacks, and many other experiences back then, comparable to Australia when we got immigration and refugees. But what they found was when they compared the responses to depression and anxiety in particular, in response to the COVID-19 lockdowns back in France, and this was only 3 months at the time, 3 months of complete lockdown, 60 million people. What they found was the responses to the lockdowns superseded, in terms of anxiety and in terms of depression, those experiences of war, of terrorist attacks, of fires, of natural disasters. This is a different, unprecedented event, and the response is even more unprecedented, and people are finding it a lot more difficult to adjust to. So yes, you're right. You can always look at something else that's happening. I say look a little bit closer to home and see what's happening to you as well. You need to compare yourself to who you were yesterday and who you'd like to be tomorrow, and where you sit with that today, because you can always find something that's, you know, supersedes. And I think that's a good.
I didn't say that. People have said that. I've actually made very specific posts about this, and that being bullshit. I don't say that at all. In fact, I don't care how well I'm doing. I know there's people that are not doing okay, and I don't care how bad I'm doing. There's people who are doing bad. Like, it's just, I've never said that. In fact, I'm very much against it. That's my point. I think you might have misinterpreted what I said. I've actually gone on to say that people have said this, and then they're also forgetting 20 other wars and a lot of shit going on as well. There's always going to be something worse, arguably. Worse is subjective. Worse is relative. And that's what I mean by the term relative. Relative means you, in your situation, what you've gone through. And that's why I said, if someone has had an easy life, and now arguably easy, and then all of a sudden they've lost everything, that's bad. And of course they're going to have some sort of issue because they've never seen that either. But in the example you've given, that's people that have suffered before and now feel they're suffering even more. There could be many reasons behind that. But it then tells you that even people who've had adversity previously feel this is worse, at least now. Maybe because they weren't expecting it, for example. They thought they were going to live a better life, and all of a sudden they get there, they find shit. Is this actually better? So I need to correct that. I don't think I'm saying that, because I definitely am not saying that.
But perhaps my response was improportionate to what because I didn't interpret you as saying that. But when it comes to people saying those sorts of things, I do understand it from their point of view, because it's almost like a realizer. You can see, for some people, it can really help to extrapolate and start to look at the bigger picture and say, okay, someone is suffering more than I am, and that can actually reduce the trauma that they're experiencing. And it's a collective trauma that we are going through today. With I would even say it's beginning to become a complex trauma and a chronic trauma, where complex trauma and simple traumas are a little bit different. Simple trauma is one event, something that has happened to you that you react against, and a complex trauma is something that happens over and over and over and over again for an indeterminate period of time. I believe that many people and I don't, this isn't just a belief. You can start to see that the responses to complex trauma, especially to those people who have been traumatized before, are starting to be re-triggered by these particular events, especially, and I want to emphasize this, it's about a loss of control. Whenever a person is traumatized, their control is taken from them. There's no agency. There's no sense of, I can do something to change the situation. Like a child being hit by an abusive parent, they haven't got the strength to change that situation. But at the same time, you kind of just live with it, because, you know, what's the alternative? I mean, even in rat studies, you start to see rats who have been traumatized by their familial relations, you know, biting and scratching, and you know, when their parents are starting to hurt them, when they run away and when they experience another stress, they run back to the first stressor. We see this all the time, where what do we do? Do we concede? Do we move forward? And to understand it in light of control, this is really important. Man, there's so much to say. It's hard to know where to begin here because we're in a bloody cooked situation.
And no one's been here before. At least not no one. There are some people, I'll take that back. There are some people who've seen something similar or akin to what's happening. But generally speaking, from the people that are on here now and people who can see this, a lot of us haven't seen this before. Our parents, our grandparents might have seen it, or a few generations ago, if they've lived through world wars, they may have seen something similar where the situation might have been at some sort of level like this, right? But most of us haven't. And this is why you also have this feeling of where is the government getting these powers from? Did they magically appear? They didn't. They've come through in years. Like the New South Wales Public Health Act was passed in 2009, and it was basically enacted in 2010. It didn't magically appear, but it's now being used, so people are seeing it. In Victoria, for example, I think it was 2008. I can't remember the exact date. But again, it's been there for years, but now all of a sudden people are seeing it used, so we're actually critically analysing it. But only because we have to, and now when we're forced to do it. But let me just take, there's someone's raised a point here, and I think this is important. We can't, look, firstly, we can't give specific advice. Either me or Emil cannot give specific advice, but I think this is a good comment, and you may have a few words here. My 14-year-old daughter hasn't left her room in 12 weeks, and her parents are really worried about her. What would you suggest? And also, I'm going to raise, I am in touch with a number of psychologists, psychiatrists, and obviously psychotherapists here. So we will, at some point, we'll figure out a way to get you in touch and stuff as well. Emil, if you've got any words for that, man.
Yeah. With 14-year-olds, I mean, between 12 to 24, you have the period of what's called adolescence. I mean, we all experience it. And when it comes to adolescence, you can break that down into certain developmental milestones. One of the developmental milestones, and I'm going to give a context before I respond. One of the developmental changes we see is emotion. Emotionality is up and down. The people who are in adolescence, 14-year-olds, are experiencing higher levels of emotion. Just generally speaking, pandemic or no pandemic. But also you've got what's called social engagement. You've got them trying to leave the nest and explore around and see, well, life is different outside rather than being at home and stuff with the parents. There's that social engagement side of it. After social engagement, you've got things like novelty. Novelty is a really important one because dopamine levels, that sense of motivation and pleasure, that hormone and neurotransmitter that's being released throughout the body, that's also at a lower baseline level through adolescence. So what that means is that you're feeling a lot more bored, generally speaking, but then when you do something really fun, that dopamine level, it starts to really increase. So you're getting more bang for your buck. And then you've got things like creative exploration, which is trying to find and figure out how the world works, your place in it, what you believe about yourself, about other people, and then people are tending to question their own identities and how they stand, and things like where they stand in the world. Now, we have to understand adolescence through that lens. And when you understand adolescence through that lens, and by the way, this is not just me speaking, there's a lot of neuroscience that backs this sense up. When a person is pulling away, when you understand it from, okay, novelty, there's less stimulation when it comes to what's happening right now if you're stuck in your room. There's less creative expression, there's less social engagement, there's there's potentially more emotionality there, unless you've really increased and then you're finding yourself a lot more depressed. And so I would approach it from those areas. Find ways to increase that sense of novelty, doing different stuff that is relatively unpredictable, that can give you a dopamine hit. Finding activities that you once did as a family and start to re-engage with those particular activities. Creative exploration, start to find ways to question what's going on. What are the different ways that you can interpret where you stand in your life right now? The social engagement, how do you find ways to connect with friends when that has been pulled away from you for no fault of your own? Listen, man, it's so understated how listening can really, really help. And I don't want to fluff it up and say how, just listen to them, sit by them, but I would say just if they're shorter than you, get below their eye level. When you get below somebody's eye level, then you start to see. So if you get to their eye level and they kind of go down a little bit and they're looking down at you, they're able to take on what you're saying at a lot more clarity, and they'll see a lot more care that comes from there. There's so many different ways, and it's hard to
practice a point, which I think is important. You're saying if you're taller than your child, for example, come down to their level, their eye level, rather than standing above them and act. So you're basically bringing down the authoritarian side of it, so to speak.
Yes.
Is that what you're saying?
And then go a tiny bit lower than their eye level. So your eyes are a little bit lower than their eyes. So they're looking down at you, almost like it's a tiny little bit. They're kind of looking at you. And then if you spin, if you can try to imagine this for a little bit, you see somebody, you see a child looking down at their parent. The child is able to feel more like, okay, this parent wants to listen. This person wants to take what I have to say. But it's not always saying. Sometimes just being there and just saying, look, listen, I don't know what you're going through right now. I haven't, but I'm here. I'm going to sit with you, and I'm really going to open myself up, and I'm going to try to understand it from your point of view. That's really important. And I mean, it goes into counseling side of things. Like, you want to sit with a person really quiet and just reflect. Pick up, what did they say, the last few things that they said, and reflect that back to them. Even 1 word, 2 words, 3 words, say that back to them, and kind of go from there.
Let's just simplify this, because you've gone through the background and context, right? But there's a few people I think want it very simple. Let's just simplify this and give them a few steps. I know that's not the way we usually do it, but just for this and Instagram's sake, a few steps. How would you do it? Without any context, just practical points, what would you say? For example, with the 14-year-old.
Yeah, so get down to their level, sit with them and say, I know I'm doing it tough, you're doing it tough, I can see you're doing it tough, I'm here. And we don't even need to talk about anything, but I really am here and I love you. And really stress that I love you, I'm here for you. And then start to find out things that they have enjoyed in the past as well, even before this. Hey, remember that time when we went camping and you fell over and you kind of jumped, you fell into a bush, and then we all started laughing, and you kind of like reinvigorate those good memories that you've had as well, to balance out the really, really negative memories that you've had up until then, or they're experiencing right now. Starting to notice those. I think if we were to put it down to 3 dot points, go back to the positive memories, start to say, I don't know what's going on, but I'm here. We're working this out together, and I'm always going to be here with you, and we're going to work this out together.
But tell me, if the 14-year-old doesn't want to talk, he or she just says, I don't want to talk, because I think that might be a problem for some kids. In my experience, just saying, I don't want to talk. What would you say then?
So if they don't want to talk, you will always say, listen, I know you don't want to talk right now, and that's okay. You don't need to talk here. What I can do is, I'm here. I'm a shoulder to lean on. I'm a person who can just sit here with you, and just sitting there, body to body contact is really, really important, because if you're just sitting next to the person, and if they're in their room, say, hey hon, can I come inside, and kind of just walk through there and just sit down and say, I'm here, babe, or I'm here, bub, or I'm here. Whatever, fully fill in the name and kind of move forward from there. Just that presence is able to potentially change, because it's often, it goes down to temperament as well. Some kids just don't want to talk as well, Yeah.
So can I ask you, let's just say this is me speculating, no one said this. Kid's locked itself or him or herself in the room. Parents are outside, or parent is outside. Now, say, for example, it comes dinner time, kid doesn't want to leave. What about having dinner in the room, in the child's room, even though they might not usually be the course of action in this particular household? But what about doing something like that? What would you suggest? Is that a practical idea? Could that work?
Oh, definitely. I think it's a really, because it's about bringing the community of people together. And when a person's trying to distance themselves, It's often not because they want to be separated. It's often because they're finding it really hard to make sense of what's going on for them at that point in time, and they're not quite sure how to talk about it to a lot of other people. So one thing to be mindful of is when a person says, "I don't know," it's like, "How you doing? How you doing? I don't know." It's not that they don't know. It's often because they either haven't thought about it or they haven't been able to put it into words. And let me just say that when a person's going through stress, the part of the brain that regulates speech is actually highly reduced in function. So that part of the brain that gets you to talk, that part's not working very well. And so that's why people, when they're highly stressed and they can't get the words out, or they mumble, or they kind of trip over the words, that's one of the reasons that's going on. So sometimes just getting that stress level down could be really useful. And some of that is just like what psychologists call co-regulation. So co-regulation is just coming together with somebody else that the person trusts and being there with them. You know, having dinner in the room, you know, if you can, it's probably not a practical idea for every single night if you're, you know, don't want to get mess everywhere or whatever, you know, but that person will start to feel held. They'll start to feel like, hey, this family cares about me.
Okay, so look, the lady said, what if she tells her to go away? I think in your specifics, you probably need to speak to Emil or another mental health care professional directly, because I think there's certain things that are probably better for outside this conversation. I think we need to keep this general. It's probably not a good idea.
Yeah, and I would say if anybody has any questions, or they just want to relay their experiences or whatever, you know, shoot me through a message, or you know, jump onto my profile and just ask me a question or whatever. I'll do my best to get in touch with your certain situation and point you towards the right direction. That's what we're here for. We want to build a community of people who are here for each other when we otherwise don't feel like we're being heard.
Yeah, look, with this, what I've seen implemented, and I believe a program I'll be starting, is trying to get kids to interact through video calls. I think it's shit. Quite frankly, I think I need to go to the park, and I think that's a better avenue. But this could also be a time where kids might not want to do that because of the situation they are facing. And maybe it's just they've gone into shutdown or locked themselves down or are within themselves for other reasons. I mean, when you've been going to school day in, day out, you have so much interaction to absolutely nothing interaction except for, I believe, recorded classes and some messages here and there. That's not going to be easy. And then look, the other thing is, if we have kids who are 14 to 18 or 17, they're going to have significant others, boyfriends, girlfriends as well. Imagine not being able to see your boyfriend, girlfriend at that age. I can only think that's not going to be a good thing at that point, and that's going to hurt more as well. I have heard situations where parents have tried to clamp down in these situations. I don't think it's a general thing. I personally don't think that's a good idea, especially right now when everyone's dealing with so much. Like, parents are too, don't get me wrong. But look, I have heard of that too. And I'm just saying, this is not as a mental health professional. This is just as a guy who also has nephews, nieces, and my own child. I personally wouldn't do that. I think the more you force upon them, or the more you shut them down, the more likely they are to shut down. But there obviously are situations where kids are going to be much harder to interact with and deal with because of their own relative and subjective reasons, which I think these guys need to speak to you or someone else, and someone else in the mental health spectrum, to actually get proper, direct advice on that. Staying in the room keeps you in the same state of mind. Look, guys, someone's actually said here, staying in the room keeps you in the same state of mind. You need to change that, change focus, change the norm. Look, I agree, but the reason I say what I do is if the child doesn't want to exit the room, unless you pull the child out forcefully and say, come out, that could also exacerbate the issue, in my opinion. And last thing you want is a child totally shutting down. But in certain situations, I 100% agree. To be honest, people need to get their exercise, need to go out. There are studies in Japan, especially we're going into nature. It's great, but not everyone has that. If you're next to a beach in Bondi, you can just jump at the beach and you have a great time. If you're from Western Sydney, which a lot of these people will be, they can't do the same. Unfortunately, they might have to go to the park near them. Well, that's changing, but it makes it harder. Is there any other questions here? Look, let's talk about this. You've been in lockdown, especially you guys in Melbourne have been in lockdown for ages. This is your 6th lockdown. What do you say to people who have been in lockdown for that long? How do they rationalise what's going on from a mental health perspective?
Right. So it's very difficult to quote unquote rationalize yourself into this situation, apart from a very basic human nature point of view. Now, isolation in itself and being cut off from activities, a person's going to automatically see that as an attempt to control oneself. So there's almost like for some people, depending on your temperament, it could be like, all right, there's some other here trying to enforce something onto me, and I'm going to rebel against that. And then there are other people who may be generally more anxious in temperament. They may genuinely be scared of this particular pandemic and this unseen evil out there, that at any point in time you walk, not even going to the shops is safe because someone could brush up against you and you could be struck down dead. And our daily press conferences isn't doing anything to kind of help with that fear. If anything, it's propagating that fear even more. And so
there might be that, but yeah, that's true.
Okay. And so on top of that, what I would always recommend when control is taken away from you, or when you find yourself you have a lack of control, it's all about looking at something in your life that you can control. Now, that is different for every person. What I can control in my life based on the restrictions, based on my own personal health, mental health, physical health, what have you, could be just like, okay, I truly believe in the 1% principle. It's something that I talk about. If you can do something that will get you 1% better tomorrow, then you need to go ahead and do that. What you need to do is try to work for 1% better every single day, rather than setting goals that are like 25%, 100% better or different within a week's time. So find something that you can control. For me, during this lockdown, it was all a matter of fitness. So for me, I went into, I set my alarm clock 5 minutes earlier every single week. And if I set my alarm clock at 5 minutes earlier, then I have 5 minutes more to my day than I had beforehand. And then, slowly getting that earlier and earlier and earlier until I'm at a place where I feel more comfortable. I can control what time I wake up. I can control how many times I go to the park. I can control what kind of food I'm eating. I can control who I'm spending time with, in terms of who I'm speaking with and how I'm going about doing that. So find something you can control and go ahead and practice that over and over and over again. When you practice that level of control, your agency and your sense of self-confidence will begin to improve. Because the reason is, when you have more control over your own circumstances, then you have more regulation over your mood, because you're building parts of the brain that are more regulatory, that are less stressed, and you're actually starting to build more calming areas into your brain because they operate on the same function. We can go into this, we can investigate the whole gamut of it, but I would say, find something you can control and do that every single day, starting today.
Someone just says, this is funny, I actually quite like this one. How about we say we fuck the rules and take our kids out? Look, I think in Melbourne it's changed anyway, hasn't it? So it's no longer there. But I never thought that was okay. I think that's one of the most disgraceful mandates I've ever seen, to stop kids going to a park. To try and stop kids getting out is absolutely disgusting. Kids don't have criminal culpability anyway, especially when they're under the age of 12 or about 10. That should never have happened. And really, look, Dan Andrews got that wrong. Whoever advised him to do that got that wrong, and I believe they've actually admitted they did that to get to parents, which is a whole new issue in itself. But that tells you that mandate directions are so disproportionate, it's not funny, and quite frankly disgusting. Yeah, there should, look, in my opinion, even if taking all this as right and all this is true, there should be no... It's not, but there should be no issues with people being able to, there should be minimal interaction allowed at the bare minimum. And really, there should have been something built in for mental health. That's not been taken. Mental health has just been pushed out the side. I really don't think the government has mental health in mind. I don't think they've done anywhere near enough. I don't think they're doing anything near enough. I don't think, like, how are they going to deal with the shit that they've done to people's lives over the next few years? If if the vaccines work and everything's above board, fine. But what the hell happens to people's mental health for the next few years? Is that going to just rebound? What do you think about that?
Yeah, so there's a lot of research, even beforehand. They've done research on survivors of the Holocaust, and what they found is when survivors, and okay, I'm not going to try to conflate these two, but I'm going to work in terms of principles. When a person is stressed, the brain acts in very particular ways to release certain stress hormones. And these are actually, especially if you're pregnant, these are passed through the placenta, and they can actually rewire the brain of children. But not just that, and so that the children are generally more temperamentally stressed, or when they're stressed, when something bad happens, they're more likely to feel stressed when they're born if the parent has experienced a lot of stress. And so what they found is that over 3 to 4 generations after the Holocaust, the great-great-great-grandchildren of Holocaust survivors were still wired, so to speak, to have more stress perception than those who had not survived the Holocaust. Now, and so there's been certain rat studies in particular that have looked at that this effect actually happens over up to about 6 to 8 generations. Really, really difficult to consider, because when a parent is stressed, they start to pass down this stress to their kids and their kids' kids and their kids' kids. Now, I'm a real big believer in you can rewire your brain, and I think that the evidence bears that out. So if a person is feeling significantly stressed, you need to find ways to take back control. You need to find ways to recalibrate your mental health response, and so that you're doing more and more things that are comfortable for you. For the longest time, I had to stop watching the daily press conferences because they were causing me more mental stress than anything else. And so that was one small thing that I could control. Yeah, let's just stop watching. Now the argument would be, well, you need to know what's going on so that you prepared for the different mandates and all that sort of stuff. But taking that back, when it comes to the effects of kids and their kids and their kids' kids, and that's just from a mental health point of view, we need to be prepared to put things in place that initiate agency in the person, that you need to take back control from what you can control. And that is so, it's so individual that I hesitate to say you need to do this and this and this and this, but I'm happy to kind of work through that.
If you're saying generally take back control, what you all said is something I've said before as well. I actually put up a post yesterday. The press conferences are full of shit. They are basically just trying to scare people, and really there should be other ways to find out what the mandates are anyway. The public health website is there, so people can always check on that. And often what they say doesn't translate into the actual mandate or direction anyway. So why put yourself through all that trauma? And this is not from a mental health standpoint, this is from a legal and a common sense bullshit standpoint. If they're just trying to dribble drabble at you to piss you off or to make you feel bad, why let them do it? Don't. I'm not saying don't read the mandate. People need to know what they are, otherwise they're going to get in trouble, and I don't want them to. But don't give them the power or the control to be able to sit there at 11 o'clock every day listening. To me, I'd rather, I use the analogy of being like a bad first date or a first date. You don't know what's going to happen. It could go left, right, or center. But when they don't even stick to what they're doing, or it's things change, when you have Gladys saying one thing in New South Wales and then John Barilaro, the Deputy Premier, says something else, it's like people are freaking out going, what's going on? I say don't listen to either of them. Wait till it's written down, actually in front of you, then we'll talk. And often I think they do it in order to, right now, in my opinion, personal opinion, to drive people a certain way. So it's a way to get them to actually listen to what they want. But look, I think what you're saying is bring back control into your own life. If you can control something, do it. I can't control what you do, but I can control what I do. If you want to watch something, you'll watch it, right? If I don't want to watch something, I won't watch it. So ultimately, we need to take responsibility and make a decision for ourselves. So sometimes it might be if you just fuck the 11 a.m. press conference, I'll deal with it later. Or if I want to, I'll call one of my friends and find out of them. As much as hearsay generally isn't a good thing, at least you can have a conversation with your friend about it, you know, smash that mandate and talk about how shit it is and have that social interaction and find out. You don't have to watch the news. You don't have to do that. Like, I mean, the mainstream media is pretty shitty anyway. It doesn't give you both sides of the spectrum, which is a problem, in my opinion. But hey, it is what it is. So if you were to simplify this as a takeaway for people, how would you simplify it? What would they do? Apart, like you said, control, but what else could they do?
Yep. Okay, I would say most of us have that unreasonably positive friend. If you have somebody who's really positive, then speak with them and get their opinion on certain situations. Because if you find yourself stressing a lot, it really helps to balance that out, to see, okay, what's this other person's opinion? Get a few different opinions. People who have had the jab versus people who haven't had the jab. If you're only speaking to people who have had the jab and that's causing anxiety for you, speak with other people's experiences or people who you admire. Follow, if your feed is full of things, of people who are talking about the negative stuff of these restrictions, start to follow more positive people as well to balance that out, so that your feed starts to get a little bit more tailored to some positive experiences, like a bodybuilder or something, or a positive affirmation. That's why I try to keep my feed on my account. I balance it out with videos of interviews that I've conducted, with quotes, with certain things. So I try to balance these sorts of things out, because when we all have what's called a confirmation bias. We will try to find evidence for something that we already believe in. And I'm guilty of that. You're guilty. We are guilty of that. If we believe something, then it's easy enough to find a confirmation for that belief. And so finding others who have a different opinion to you could be really useful. And again, when it comes to things like control, find what you can control and head on to that. You're 1% better over 100 days. You're 100% better than you were 100 days in the past, previous to that, in that one thing. Okay, in that one thing that you're trying to change. So that's really important to consider. I mean, there's so many different things that you could do. When you have kids, for example, try to create stability with their daily interactions. Like have a time that they wake up, have a time that they eat lunch, have a time that they go to sleep. Sleep routine is really important. So, for example, if you've given up reading with your kids before bed, choose a book that depending on the age of your child, start reading with your kids and start to have a sleep time routine with your kids as well. And you'll start to notice that their mood begins to change, and they'll start to pick up. Kids are really good at modeling behaviors. How you express yourself will be picked up by your kids more than what you say. Really important to consider. There's so many more, but I don't know how much time we've got.
No, look, I think we should wrap it up soon because we've been going for a bit. But look, do you want to just tell people where you're at, so if they want to find you?
Yeah, definitely. So I am on all the socials. If you look at the Emil Banga on Instagram, I'm on there. I upload a whole bunch of mental health related stuff. If you want to catch me on YouTube, I'm on Emilio Banga, EMILIO BARNA. You can find all my interviews that I've conducted there. Some of the more recent ones are on mental health, lockdowns, that sort of stuff, as well as very practical strategies that you guys can do to calm your own bodies. I have a podcast called the Emil Banga podcast. If you're into that sort of stuff, have a look at that. Yeah, Facebook, Twitter. I don't use Facebook and Twitter that much. I'm more on YouTube and on Instagram and on the podcast a little bit more. That's where I'm at.
Sounds good. All right, guys, we'll wrap it up. Check his stuff out. He's just told you where you can go. And I'll see you guys at some point shortly. Have a good Sunday afternoon. See you, mate.
Thank you, Samir. I want to say thanks for all the work that you're doing. It's really good to see that you're bringing more and more voices to light. And I appreciate it. I appreciate the work you've done. And thanks for inviting me on this particular live.
Cheers, man. Thanks for joining us. Gotcha.
Thank you. Have a good one, man. Bye.